The London Bridge Sports Medicine Podcast. Medical news, health, fitness. With Dr. AJ Seth.
Hiya. Today we talk to Catherine, who is suffering with inflammatory spine disease. She tells us how this came about for her and how now she's living with her condition. Most of the time, back pain can be managed with the right rehab, but sometimes inflammation of the spine needs to be considered and ruled out. If you feel any of the symptoms or issues Catherine talks about applies to you, please do get in touch to see how we can help. Hope you enjoy listening. Hi Catherine, welcome to Extraordinary Patient Stories. Thanks for being here with us.
Thanks for having me.
So Catherine, you've got a very interesting story, and we've been looking after you now for a good few months. So let's go back to when you first came to the clinic. And you were having, for you, things started with your back, didn't it? It started as a presentation of back pain. If you can remember all those months ago, what happened? Why did you end up coming to the clinic?
Well, it was actually, I've had back pain since I was about 15, 16 years old. And I've always complained about it. And I've always gone to like physio and chiropractors and things like that. And then I think it was about August time, I found this lump on it was a hard lump on my left sacroiliac joint, and sort of like moving it around, and I was getting a bit concerned. And you leave these things for a while, and it sort of like builds up the anxiety. And then I sort of eventually came to the conclusion that it was something I wanted to go get checked out. So I went to the doctors, and they sent me for an MRI with you. But it was a small lump that was moving, but it was more that the fact that there was like a dull ache coming from that pain. And it was different to the pain I had normally felt, which was very much in my spine. Yeah. And this was more in my hip joint. And so I was like, well, it's obviously something different. It's not just the usual back pain. So I thought, come get it checked out.
And so was the lump itself painful, or was it just the dull ache from behind, just in that sort of buttock sort of area?
Yeah, no, it wasn't the lump itself. It was the joint. Obviously I didn't realize that at the time. I thought it was the lump that was causing the pain. But it was like a dull ache underneath the lump. Okay.
And how did that pain sort of affect your day-to-day life? You're obviously quite sporty. You've done a lot of sport growing up, and you still continue to do so. How was it affecting sort of day-to-day life from that point of view?
Yeah, it's a really tricky one, because some days it's, you'll be feeling great, and then just at one point in the afternoon, you'll be completely wiped out and you won't want to move, and everyone will be like, where's all the energy going? I don't know. Yeah. But it's very unpredictable, I would say. Some days you feel great. At some point in the day you feel great, and then you feel terrible. So it's so hit or miss.
So it was related to fatigue type symptoms.
Definitely, yeah.
And what about times of day? Was there any particular time of day where it was worse, or
Well, I'm always stiff in the morning when I first get out of bed, and I have to sort of, I guess everyone does that, they stretch when they get out of bed, but very noticeably, I'm very stiff. Yeah. And throughout the day, I normally have quite good energy levels in the morning when I first wake up, or sort of like an hour after I've woken up. And then I get this real lull in the afternoon. And by the time the evenings come and I'm sitting on the sofa, I'm thinking, I am not getting up from here. There's absolutely nothing that's going to get me up. And then by bedtime, I'm usually in quite a lot of pain.
And is that something that was becoming more frequent, or was that something that was just consistently there?
Yeah, no, I think the last 6 months it's really spiraled. When I first came to you in September, it was sort of, it was the worst it had been ever before that, but it was just sort of like something that was nagging me. Now it's like a continuous pain, and that gets worse to the point where sometimes it's completely debilitating. But it sounds a bit dramatic, but most of the time it's okay. But yes, it's got progressively worse.
Okay, and so you mentioned the fatigue type symptoms. Was there any other joints that were hurting or causing problems at that stage? Do you remember before we got the MRI done?
Well, yeah, my lumbar spine is
Yeah.
where it was where my main pain was, and it was always like I always felt like I needed to click it, which I know is terrible, but I always did then click it.
Yeah.
And the muscles either side of them always were quite achy. I think maybe because they were compensating.
Yeah.
And I would always get pain on my neck as well. It's sort of like sometimes it was like a sharp pain, but it was usually just like an achiness.
Okay. So then you came and saw us in clinic, and we did the MRI scan, and just tell the listeners that what the MRI scan showed.
Yeah, so it showed, I believe it's sacroiliitis, which is just inflammation of sacroiliac joints.
Okay. Yeah, and that was an explanation for why you're getting the dull ache, and a possible explanation of why that lump was there, because there was some inflammation fluid around the joint. But also it was an indicator that there was some underlying inflammation in the spine. And then we went down the route of getting blood tests and going down that in sort of investigation. And this is a condition that's called axial spondyloarthritis, which basically means inflammation of the spine. And it doesn't just affect the spine, because then other things started to hurt and cause problems. Is that right?
Yeah. Like my ankles would always swell and random things like that.
So what were the other main joints? The ankles, and describe that sort of chest pain as well.
Oh yeah, that's the worst. It's like a very tight pain, and it's particularly when you're moving, it just feels so stiff and restricted. And you just put your arms up in the air or do something like that, and it's sort of like, it's hard to explain, like someone sort of like pulling your chest apart or something.
Yeah. And that's actually very common. So it's the irritation and the inflammation of the joints around the front of the chest, where the ribs meet the breastbone, can get really inflamed as well. So you were showing signs and symptoms of this condition. So then you went to go see the rheumatologist. So a rheumatologist is someone who deals with these weird and wonderful types of young people's arthritis. What did he say?
Yeah, he was really great. He sort of explained everything to me, gave me a load of resources to go and do some research about the condition. And he also referred me to a rheumatological physiotherapist, who has been helping me sort of like manage it on a day-to-day basis. Yeah, it was really helpful to get some understanding of it and like be able to, because it's, you can go and read about it all and you sort of freak yourself out, but until you're told, how it affects you, it's quite difficult to understand it practically.
And you mentioned the physiotherapy. What kinds of things are you doing that helps day-to-day life?
Yeah, so it wasn't physiotherapy in the way that you normally think about it. It was more talking about trying to identify my triggers, and implementing an exercise regime that can help reduce the inflammation, because exercise is really good for reducing inflammation. So I was actually supposed to start this really intensive exercise training program, and eventually I wasn't able to finish it because there was a lot of other symptoms that were going on at the time, which made it difficult to complete. But I think that's definitely something that would have been really helpful had it not been for these other symptoms. Mainly identifying triggers and things like that.
Okay, and so going back to your symptoms, what ones do you think are the most debilitating? Because you've obviously had some other changes now with regards to your sort of skin and nails and things. Just describe sort of which ones affect your day-to-day life.
Yeah. I think the worst now is my thoracic spine. It's so painful all the time. And that's the thing about the arthritis, is it's so unpredictable and you just have absolutely no idea when it's going to hit you and completely wipe you out. So you might be in the middle of, a social occasion, for example, and suddenly, you want to like burst into tears, or you just got to squeeze really hard to get rid of the pain. But I would say the pain in my thoracic spine is definitely the worst. And then probably my neck is pretty bad. But yeah, I mean, it was really interesting when I was just painting my nails the other day, and I noticed they'd gone really yellow around the edges and had these black lines in them. And then I came and saw Dr. Seth, something unrelated, and he asked me how my nail health was, and I showed him the photo, and he was like, yeah, I thought so. And it was randomly related to the arthritis.
And nail signs are actually a subtle sign that there is some inflammation going on in the body, particularly with autoimmune conditions. So just on that note, there's a few other conditions that can be related to arthritis, and you had some issues with your bowels as well. Do you mind just talking about that for a little bit?
Yeah, of course. So again, I've had it since I was about 15, 16. Obviously never really worked out what it was. Went to the doctors a few times, and I was actually diagnosed with IBS back at university, but without having had any tests done. It was just sort of like a process of elimination. A few months after I was diagnosed with the arthritis, I started seeing a dietitian, as per Dr. Seth's request. Thank you for that. And she was sort of monitoring my symptoms, asked me to keep a symptom diary. And she was like, I'm just not happy with this. I was getting really severe bloating, really irregular bowel movements, really painful stomach, and it was constant, and really bad heartburn as well. And so she referred me to a gastroenterologist, who then carried out a number of tests, including a colonoscopy, which I would not recommend. They found 2 precancerous polyps, which I don't think are related to the arthritis, as far as I'm aware.
They're not necessarily related directly, but the kinds of symptoms you've mentioned, in terms of the bloating, the change in bowel habits, can be suggestive of IBD, so inflammatory bowel disease, which is often confused with IBS, irritable bowel syndrome. But I think in your case, fortunately, that they took a few biopsies and there wasn't any sign of IBD. But that is definitely a sign and symptom to look out for. And sometimes these tests aren't always 100% conclusive. So you might go in with a colonoscopy and have a look at the bowel, but actually you can't, for 100% certainty, say there isn't any inflammation going on there. So, I mean, you've hit the nail on the head there, Catherine, because actually sometimes these symptoms are progressive over a long time, and they can be quite subtle, and they don't always present with barn door classic, the textbooks, how the textbooks describe them. So I think it's probably something that is related to what's, everything that's going on at the moment. And it sounds like you're having a horrible time at the moment, going through it all. So I mean, I'm really sorry, and I'm sure everyone listening is really sympathising with you, just because it's not a great thing to go through. So just in terms of the treatments, we've obviously started you on a course of steroid injections. How did that change the symptoms? So we've had 3 so far, or 2?
2. I've had 2 so far. I probably should have had a second one in between.
Yeah.
But it's really interesting, because I thought initially, the day after my first injection, I was like, wow, this has worked amazingly. I'm cured, I'm so much better. And then the day after that, I then had a really bad flare, and it lasted probably about 3-4 days. And so I was like, oh, these haven't worked at all. And then as time went on, for the rest of that month, I was like, oh, it's not worked. But then you forget, it's very easy to forget just how bad it is when you're having a flare. Because when it's there constantly, you're like, oh, it's still really bad. But it's just, you don't think about how bad it can be, or it has been in the past. So I think my first steroid injection was actually much more successful than I thought it was. And then when in the following months I didn't have any of the steroid injection, it sort of all came back, and it came back much worse. And I was sort of thinking, oh God, why didn't I get another one? But I mean, I came in and saw you a week ago or whenever it was, get my second injection, and I can definitely tell a difference this time. I mean, that's not to say that it goes completely, which is what I think I had falsely expected myself the first time. But it's definitely settled down 100%.
And the steroid injection is into the gluteal muscle, and essentially what it's trying to do is dampen the immune system. So it's trying to tell your body, look, just relax, calm down, don't attack your own joints. So it dampens down the immune system, but it's and sometimes that's enough. So you are right. Sometimes it is enough that you don't need other treatments, but more often than not, sometimes, particularly when symptoms are quite severe, you need to go on to other types of medications. And you are due to see another rheumatologist about that, aren't you? Just tell us a bit about that appointment and what's happening there.
So I had an appointment with a rheumatologist about starting biologic treatment or a course of non-steroidal anti-inflammatory medication. But we decided that because I have, potentially inflammation in my bowels, and if not inflammation, then definitely there's it's irritated, and the non-steroidal anti-inflammatories can be quite damaging to your gut. So my gastroenterologist was like, I think if you have the choice, it would be better to just go straight on to the biologics. Okay. And especially, I think, as far as I'm aware, they have a much better success rate in young people. So it's better that I just start them now rather than going down the course of anti-inflammatories and then have to go on to biologics eventually anyway. By which point my stomach will have suffered the consequences. So yes, I'm due to see my rheumatologist again in June, but I'm going to try and move it up.
try and move it forward, and the idea is to start on these relatively new drugs called biologic drugs, and what they do is, rather than dampen down the immune system, they are essentially changing the way the immune system works to some degree. So it's a slightly different approach from what the steroid tablets are. And you're absolutely right. I think having these treatments done at a very young age is actually much better for the prognosis going forward. So if you were suffering with these sorts of symptoms, and arthritis does take its toll on the body over many, many years, that can be quite destructive for the joints and angry. So I know what I've been saying for you, Catherine, is that I know it's a lot you've been going through at the moment, but actually for the long-term health of your body, it's better to be on the right treatments earlier than rather than later.
Yeah.
Just tell me then, in terms of your general lifestyle, how has this changed the way you exercise, what you eat, your body awareness? Tell us how it's really affected you from a sort of day-to-day point of view.
Yeah, I think initially it literally controlled my life. I wouldn't exercise when I was in pain because I wasn't sure what was causing the pain. And, if you think if it's something mechanical, then you don't want to exercise and make it worse. I try now to exercise as regularly as I can. Obviously, there are times when I think, there's absolutely no way I'm getting off the sofa because the fatigue, it does wipe you out. But I used to eat very unhealthily, and now, well, not very unhealthily, but unhealthily enough. And now I'm very strict about what I eat. I try to eat anti-inflammatory foods. and I eat lots of seeds and nuts and get lots of protein.
Do you feel that makes a difference, the anti-inflammatory foods?
Definitely. I think changing my diet was one of the best things I could have done. It's made me feel, I mean, in terms of pain, not so much. No, it's not so noticeable, but in terms of the fatigue, it really, really helps. And I used to often miss breakfast, and I'd have a coffee instead and then have a lunch at about midday. And I didn't realize, but I mean, for some people, obviously that works. But for me, it was making my fatigue in the afternoon so much worse. So I am now very regimented. I wake up and I have breakfast. I try not to drink so much coffee because obviously it really isn't good for my stomach, especially on my stomach. But yeah, I think changing my diet was really helpful.
And what about exercise?
Exercise, I'm still trying to come to terms with the whole exercising. I love playing tennis, and I play that regularly. I'm hoping that when things are opening up again, well, I know they're open, but when it's sort of safe for everyone to go into gyms and go to the pools and stuff, I can take swimming again. But I love doing yoga as well. It's difficult because I still find that I'm not quite there with the exercise. I still let my pain control me in that sense. But I mean, hopefully once I'm on the biologics, I don't need to worry anymore.
I think, and I think it's always one step at a time, isn't it? So for you and your own patient journey, that is the next step. And I think, as you said before, exercise does have a very, very important role in reducing joint inflammation and actually, dampening down your immune system and priming it. But there is always a combination. It always needs to be done with the right sort of medical treatment at the same time.
It's such a vicious cycle because I mean, I know that exercise is good and it's anti-inflammatory, but I'm in pain, so I don't exercise, but then I don't exercise, so I'm in pain. And so it's just, it's just this, you've got to break out of that cycle and try to push yourself to do something nice.
And what would be your, so if someone was suffering similar symptoms, what would be your main top tips for a young person who may be suffering with joint pain or back pain?
My biggest regret is not pushing for a diagnosis earlier. I wish I could go back to my 16-year-old self and say, do some research, figure out if this is what you have, and go ask your doctors if this is the specific condition that you have. I had psoriasis, which is linked to the arthritis. So it would have made sense if I had explained it's very hard to explain the arthritic pain, I would say, because it's so unpredictable and it's always changing. But just because you don't have it that day, then write it down, say when you felt that pain and then what that pain was, and then go to your doctors and explain that, you're having all of these different symptoms and they're all at different times. And then they might be able to piece something together. But if you don't acknowledge the pain, then you leave years without the diagnosis like I did. You're not giving yourself as good an opportunity. I think.
That's great advice, and I think a pain diary, essentially, is what you're describing, is really important, because when you see a medical professional, you are essentially getting their opinion, and the more information you can give to them, the better, and the more detailed approach you take to giving them that information, it helps them out. And and the other key thing you said there, Catherine, is understanding your symptoms. The body tells us different things in different ways. So actually, arthritic pain, like you've got, may be very different to the type of pain you have when you sprain your ankle or twist your knee or something. So it's actually understanding the character of what's going on is very important as well, which is very difficult to do when you're 16 years old.
No, definitely. I actually would say learning the words that are used to describe certain pains really helped me, because I couldn't pinpoint exactly what the pain was or explain it in my own words. So going online and reading about the type of pain you might feel, and then reading it and being like, is that what I'm actually feeling? You know, like if it's a dull ache, it's much easier to understand that that's what you've got if you're told that that's something that you might have, if that makes sense.
Yeah.
But
If you are a 16 to 22-year-old female and you came into a doctor's and said, I have a dull ache in my sacroiliac joint all the time, it disturbs my sleep, I've got psoriasis, then, you know, a doctor's much more likely to something to click. And if they don't, you should probably be going to get a second opinion from another doctor. So it's just these little signs, you know, and the more information you can give, the better.
Yeah.
So thank you. I mean, thank you so much, Catherine. I know you are going through a very turbulent time at the moment, but I think it was good talking to you now while you're in the midst of things. And ideally, we'll touch base again after you've perhaps started the biologic treatments and things have settled down, to understand how that has changed things and how that's affected, you know, and just continue the story.
Yeah, that'd be great.
But good luck with it all, and we all wish you the very best, and I'll see you soon in clinic.
Thanks very much for having me.
All right, take care. Bye-bye. Thank you for listening to LBSM's Extraordinary Patient Stories. We really hope you enjoyed listening. If any of the topics discussed are relevant to you, or you want to find out more, please get in touch by phone, email, social media, or visit our website. Thanks again, and see you soon.